Recovery is not going to solve a problem you don't have. Okay, recovery is required to solve fatigue. You're trying to recover from the fatigue that you're inducing in the gym. Doing all that recovery without the stimulus, without that problem in the first place, isn't going to promote any of the physique changes that you want to see. For a lot of people, that causes them confusion because they're on a training program and all of a sudden they see something new on Instagram and they want to try it, and they go ahead and try it, and then they change their program, and they're not giving themselves enough time to actually diagnose whether the program is working or not, because they're constantly being hit with information. The amount of volume you can pack into 45 minutes twice a week should be more than enough to build muscle and strength. GLP-1s are going to be a game changer. So someone could be communicating an accurate message.
Hi everyone, welcome to the Balance Talk Show. Today we are going to talk about fitness. It's something that a lot of information out there, rather say a lot of misinformation out there. We are going to talk with Dr. Martin Refalo. He is an educator, researcher, he is highly experienced. He is co-owner of JPS Education and Health Fitness, and I think recently you have been president of WNBF Australia as well.
Yeah, the Bodybuilding Federation, WNBF Australia, that's right.
And what in my language, the simple language I say, he's a walking ChatGPT in fitness and health industry, am I right?
I try.
So before we start anything, I think Martin, I want to know, how did you end up in this fitness industry?
Wow, so I've been in the industry now for roughly 12 years. So I started, it's been longer. I started when I was 16. I was working at a gym at the age of 16. So in reality, it's been longer than 12 years, but I guess I've been working as a coach for roughly 12 years. And across that whole time span, I've also been studying. So I did a bachelor's degree in exercise science, worked my way up to a PhD in exercise science as well. And really, it's just the culmination of hard work and passion for the industry. So everything that I've always done has revolved around training and nutrition and fitness in general. And it's an honor now to be in a position where I co-own a gym, where I'm the president of a bodybuilding federation, still coach clients to an extent as well. And I guess that diversity in my work portfolio keeps me going and keeps me motivated.
And keeps growing as well.
Keeps growing too.
And why JPS Education?
Yeah, so I've been working at JPS now for 9 years. So it's been a while. I spent most of my time coaching there, and then things evolved and just got bigger, and we started doing lectures and courses nationally and internationally, and things grew from there. And eventually I was able to become a part of the business structure with my colleagues Sam and Jacob. And the goal is to keep growing and continue raising the standard of the fitness industry.
I agree that. I think I have been in one of your workshops, and JPS Education has been big help when I started my journey as a fitness coach. But do you think fitness courses now, as a personal trainer courses, are getting shorter and shorter? Are these good for industry or bad?
Yeah, I think they are getting shorter and shorter.
Yes.
And they also seem to be getting cheaper too.
Yes.
If you look at the Cert 3 and 4 in fitness across Australia, there's quite a range of different course durations and course costs. And it's quite confusing sometimes to the consumer, because if they can do a course that only takes 3 months and only costs $1,000, like, why wouldn't you? But if you dig a bit deeper, there are reasons why you probably shouldn't do that. And that comes down to the quality of the course and the customer service and a whole bunch of other things too. But I think the barrier to entry for personal training is almost at an all-time low.
Yes. I mean, a lot of young athletes, I would say, or young people are getting attracted to be a personal trainer. Now, what do you suggest to those aspiring trainers? I think having good physique is a byproduct for them because they are young and their lifestyle is there. What is the quality you think, as a coach, obviously, as an educator as well, them to have that in this generation now?
Yeah, no doubt the one quality that comes to mind is leadership. So if you think about the difference between a personal trainer and a coach. Okay, so there's a lot of personal trainers out there, people who take a 30, 45-minute session and just see their clients next week. But there's also coaches out there. And I guess at face value, the job itself is the same. But again, if you dig a bit deeper, there's so many traits that a great coach may have that an everyday personal trainer just doesn't. And all those traits, if you think about the things that it takes to be a good coach, they can all fall under the category of leadership. So being a good leader, being a role model, being a great communicator, these are all things that the great leaders that we all look up to have. They're all traits that these great leaders have. And I think if you are a young personal trainer out there, think about all the things that it's going to take for you to become a good leader. Some people are born leaders. Other people have to build the traits and the characteristics. I was one of those people. So as a up and coming kind of trainer, the leadership qualities that I had needed to be nurtured. They needed to be fostered. I needed to be in the right environment, surround myself with the right people. And that environment, along with a deliberate effort to actually build certain traits, can go a long way. And I think leadership is that cornerstone trait that all good coaches have.
So do you think exactly what you said, the quality of leadership should be there? It should be included in the course?
Well, it should be. I think so. I think the Cert 3 and 4 is we all know it's an entry level.
I did Cert 3 obviously and 4 in 2017. If I'm being honest, whatever I've learned there, it's all theoretical. My brain doesn't work when it comes to theory. I'm more of a practical person. I've learned on the field. Had a lot of rejection when I started, being in the middle age, being a woman, ethnicity, short height, everything was there. But being a leader, as you said, I'm born like that. I have to be like, you are doing this. And it worked well for me. That was beyond theory. And it's still working. So do you think those qualities should be included? Because it's just hard to, it's like we are in very different generation. It's very hard to go and build a business now.
Correct. There's definitely a lot of things that could and maybe should be included in the Cert 3 and 4. At the end of the day, it's an entry-level course, so there's only so much that can be packed into it. I guess what we do at JPS, because we are Cert 3 and 4 course providers, is we try and add the additional layer of knowledge that is so important for new up-and-coming coaches to have. So look, every course out there probably has strengths and weaknesses, so we don't want to be too critical about the Cert 3 and 4, but anyone looking to enter the industry should also look beyond just those courses. So yes, I need to do those 2 courses to become a qualified personal trainer, but I also need to be open to a whole range of other things that need to be learned.
Keep learning and keep growing to be able to be a great trainer. Now, obviously, you just said that you are in industry for a long, long time. What do you think has changed for a good or for challenging in last 20 years?
Yeah, so I guess you could summarize the last 10 to 20 years, or at least the time that I've been around, as a pendulum swing. So we see a lot of topics that swing from one end to the other, so from one extreme to the other. So if you look at every topic and kind of analyze it over the course of years, you'll see that. So, when I first got into the industry, meal planning was quite heavily emphasized, and then that swung all the way through to flexible dieting. And there were many years where the industry was like drowned in flexible dieting, and it seemed now to kind of come slightly back. I'm not sure how much further back it has come, but it definitely has. And the same thing goes for training. So when I started training, a lot of the content was around high volume training. And now it's swinging back, and we're seeing a lot of low volume training come back into the mix. And it's this fluctuation of information. And these days, one thing that is important for people to understand is that information kind of gets to you before you even seek it out. So when I first got into the industry, I'd follow a program and I'd keep doing that program until I kind of hit a wall or got stuck, and then I'd go out and look for the answer. So I'd Google search, I'd go on bodybuilding.com and I'd try to find the answer. These days, you don't really get any warning. You log into your social media and there's information everywhere.
Overloaded,
And for a lot of people, that causes them confusion because they're on a training program and all of a sudden they see something new on Instagram and they want to try it, and they go ahead and try it, and then they change their program, and they're not giving themselves enough time to actually diagnose whether the program is working or not, because they're constantly being hit with information. And again, 10 to 15 years ago when I entered the industry, I sought out information when I needed it, and that gave me much more time to actually diagnose things on my own.
Yes.
And I think that's definitely like a stark, I guess, observation that I've made, especially when talking to trainers and talking to people who attend our courses. A lot of the conversation centers around how do we go about navigating social media and that information landscape on social media.
Wow. And one of your researchers is like training to failure. Okay. Can you explain exactly what it is? What does that mean? And is it for everyone?
Yeah, so the point of failure in the gym seems to be highly kind of discussed and debated. I guess for our purposes, failing a set in the gym is getting to the point where you're no longer able to complete the concentric portion of the rep despite attempting to do so. So what I'm referring to there is an involuntary set termination, which means you're trying to lift the weight, but you actually can't. Most people don't get to that point in the gym, at least if you really, really zoom out and kind of look at the general person who is stepping foot in the gym to train to improve their body composition. If you were to watch most people do their sets, they're likely stopping at what we call volitional failure, which is the point where you think you've reached failure, or you think you can't do no more, but that's not really the case. And I guess the reason failure is so highly discussed in the industry is because what we see in the research, doing more within a set to attain more stimulus does seem to be better to an extent, at least for building muscle. So we want to teach clients how to train harder, especially given the fact that most probably don't train hard enough. And that's why failure is such a big part of that discussion, because we need to teach clients how to move closer to failure and then do so strategically across a whole session.
Yeah, because it's a practice. It's like people won't know straight away that, okay, I'm training enough or this is a failure, because they are more scared of getting injured before the failure.
Yeah, correct. And I guess if you teach people in the right way and you program the right exercise with the right techniques, the injury risk can be lower. Injuries are hard to exactly pinpoint sometimes why they happen. It can be completely due to bad luck in many cases. So I don't think there's like a direct correlation, for example, between training to failure and getting injured, at least on exercises where it's pretty safe to do so.
And what do you think of mind-muscle connection?
Mind-muscle connection is a term that I remember reading a lot about in the forums. And back then, it seemed to me that it meant how you internalize the attention you put towards a muscle, right? That internal attention that you're directing towards a muscle, trying to improve the sensation that you get from that muscle. In the research, we see some studies that try to look into that, but because it's quite an ambiguous concept, right? It's very hard to quantify mind-muscle connection. We don't have too much to go off. It seems that having an internal focus and actually thinking about the muscle that you're contracting may help in certain circumstances, maybe in isolation exercises, for example. But for the most part, the external focus, which would be thinking about ways to move the weight as opposed to actually feeling the muscle, that can usually help people lift a lot more, do a lot more reps, and usually obtain a greater stimulus by virtue of that. So most people would benefit from thinking externally, in the sense of thinking about cues that, for example, get them to move the weight a bit faster or to push harder off the floor. if they're doing a squat or whatever it is. And usually those types of external cues that help improve force production, they allow people to get more out of the set and then help them build muscle. Of course, though, if we're working with someone who's a bit more advanced and who has that part of the story all ticked off, all those boxes are ticked off, then great. The internal focus and the mind-muscle connection may help them take their sets a bit further or get a little bit more out of each rep that they're doing.
So what do you think of, like, by doing enough bracing and slow eccentric helps in mind-muscle connection?
Yeah, for sure. So bracing is a cue. Not sure I'd call it an external kind of cue, but it's a way to stabilize the body, which is important when you're trying to produce force. Slow eccentrics, of course, that's a general recommendation for most people.
Do you think it's better for as you get older, slow eccentric?
Yeah, I think a slow eccentric for most people is a good idea. I think as individuals get older, possibly you could hypothesize it being beneficial there, possibly from like a joint health perspective. However, that's a general recommendation for me, for most people. Slow eccentrics, try to feel the muscle and then try to be somewhat explosive on the concentric in a controlled manner. And of course, there's exercise dependent differences, but for the most part, that's a good way to approach it.
So if you have to give like 3 principles or tips to building a great muscle, what is that?
To building muscle, definitely training closer to failure and teaching yourself to push closer to failure and not stopping because of discomfort. That would be one important tip. Push closer to failure and try and push beyond the discomfort. The second would be learning the right technique on each exercise to ensure that the tension is going to the target muscle. And look, there's more than one way to perform an exercise. Is there an optimal technique? Maybe. Does your technique need to be optimal all the time? Probably not. So finding a way to ensure the tension is going where it needs to be is a second rule, I guess, or important point that people should consider. And then the third, just training frequently enough and accumulating enough volume over time. And interestingly, for a lot of people, for a majority, the minimum effective dose is actually quite low. So you don't actually need, if you're doing the first 2 things, so if you're training hard enough and with appropriate technique, the dose that you need is probably lower than you think to build some muscle. Now, if you did a little bit more, would you build more muscle? Yes, you would. But that's where you then have to consider the volume and the amount of time it takes to do that volume within your capabilities as an individual. Right? Some people can't train 6 days a week. They might benefit from it, but they can't do it. So they have to work that within their
That is what I wanted to ask. Like, imagine if a busy everyday person is coming to the gym. Obviously, a corporate person or a busy mother, they only have 45 minutes 2 days a week.
That's right.
Do you think they can still build the muscle and strength?
For sure. And those are the people where the first 2 ideas, the proximity to failure and the technique, for them it's crucial. If they nail those 2 things, no doubt the amount of volume you can pack into 45 minutes twice a week should be more than enough to build muscle and strength. In fact, the research definitely supports that. And even higher level individuals can build muscle with 1 to 2 to 3 sessions a week, right? And we're talking about people who are quite advanced. So for the everyday person, no doubt that is possible.
So this is like for people who always thinks all or nothing. 2 days a week, 45 minutes is enough. It's just a matter of you getting into the gym and starting.
Correct.
And this is for people who are starting brand new. Like, they don't know exactly what to do. They are getting into the gym. Now, do they focus on training or a recovery?
This is an interesting one. So I recently went to a gym. It's a gym for wealthy people. I'm not even sure I would call it a gym. It's more so a facility.
I know exactly.
And
that's what you're talking about. It's a facility. It's a wellness center.
Yeah, it's a wellness center, and they have a lot of recovery facilities within the facility itself. They have their little gym, recovery. They have a restaurant, and we had a tour through the facility. And most people, I would dare say, a majority of the people I saw in there were either spending time in the restaurant or spending time recovering. Now, recovery is not going to solve a problem you don't have. Okay, recovery is required to solve fatigue. You're trying to recover from the fatigue that you're inducing in the gym or from your daily life. Now, doing all that recovery without the stimulus and without that problem in the first place isn't going to promote any of the physique changes that you want to see. It's not going to promote any of the strength development that you want to see either. So I think people who are brand new need to focus on prioritizing their training and then adding in the recovery as they go. So it should be training first, recovery second. If you set up a well-designed program, you won't really need a whole heap of recovery to begin with. Like if there's a well-designed program that doesn't have too much overlap, that isn't causing too much strain on the body, recovery only needs to come into play down the track. And there's nothing wrong with doing a little bit of recovery here and there. No doubt, it makes you feel better and it is good for the body, but training needs to come first.
Do you think those are the trend at the moment going on, the recovery trend?
It's definitely a trend, and it's quite easy to see the trends come and go, similar to the pendulum swinging one way and then the other. It's a trend at the moment, and like I said, there is something to be said for doing a recovery strategy to feel better, because mentally there's something there as well, but it's just not going to change your body.
And we're talking about the trend. Do you think internet is making more informed or more confused?
Yeah, it's probably a bit of both. So information comes at a cost. Information is good, but it comes at a cost. So you have to try to memorize it. You have to try and reconcile it with conflicting information that you might already have in your head, and then you have to figure out what to actually do with it. That's the cost. It's not just a matter of absorbing the information and then moving on with your day. You have to absorb it and then do something with it. And, in theory, there is an optimal amount of information that we need to write a program and to get good results. Now, we don't know what that optimal amount is, but it's a thing. So the best we can do is learn as much as we can, but then ensure that we have a way to distill that information and actually do something with it. And that's where people go wrong. So they learn more and more because they think they need to know more to write a good program or to get good results. So they learn more and more and absorb more and more from social media, but there's no framework that can piece that together into a philosophy, right? If you have a philosophy and you use that to guide the way you think, and you're strategic about what information you let in and what information you let out, you're not going to be overwhelmed. You're not going to be confused, and you're going to get great results. So information is good up to a point, and most people, given that social media provides you with so much information, most people need to spend more time thinking about their philosophies and a framework for actually doing something with that information. Like, how do you practically apply it? That's what you need to spend time thinking about.
So how do you know who is saying evidence-based and real role model or compared to real model? How would you differentiate?
There's some factors that come to mind. The first one is how the message is communicated. So a lot of time we spend thinking about the content of a message. So is this message accurate or is it inaccurate? Is it misinformation or is it good information? That's definitely something to consider, because we want to move towards absorbing and consuming more accurate information, and we want to listen to people who are saying the right things. But we also need to put some stock into how that message is communicated. So someone could be communicating an accurate message in a way that doesn't come across as being very scientific, in a way that I wouldn't classify as evidence-based. If they're very absolute in the way they're speaking, if they're very black and white in the way they speak, if the way they reason is more for them to win and less about them trying to find out. To me, that's a bit of a red flag, because I might be confident about the accuracy of my message, but I still want to convey it in a way where I'm leaving the door open for some uncertainty and for some debate, right? Because we should be open to debating certain ideas, even if we're highly confident they're accurate. And I think the way that someone communicates a message should be the first thing people think about when they're trying to decide whether or not to listen to that person.
No, I agree, because every body is genetically different, and sometimes what research says, 90%, 70% apply to one body, 50% applies to another, not necessarily applied to completely to a complete other person, because ethnically everyone is very, very different, and what science says is not, I'm not saying it's wrong, it is right, but it may not apply to everyone.
Correct.
So what you said is just right, like keep the doors open for people to try and practice on your own.
Correct.
Now, what about the soreness? Is soreness a good sign?
Soreness, I think, on average, is a good sign. It's again hotly debated in the industry, and this one has also kind of, seen the pendulum swing. I think just because you are sore doesn't mean you have had a good workout, right? I mean, actually, I should rephrase that. If you experience soreness, you've likely done something to the muscle that has hopefully prompted some changes within it, whether they're, hopefully muscle hypertrophy. So feeling some soreness, likely going to be a positive. But just because you don't feel soreness doesn't mean you haven't had a good workout.
Okay.
So I could train today and I could not be sore tomorrow, and that workout could still be great, right? It could still be effective and could still promote the physiological changes we need to grow muscle or build strength. And that's where people get a bit caught up. It's the thought process of, well, I'm not sore, so am I doing enough? And the answer to that is, well, yeah, you could be doing enough even if you're not sore, because the body is quite resilient, and the more times you impose the same stimulus, the less of a novelty effect you're going to have. So in many cases, we become sore when what we're doing is novel, when what we're doing is new. And if you follow the same program for 6 to 7 weeks, you're not going to be as sore, but you're still getting good workouts in. So that's important to understand. And then on the other side is, well, yeah, we can try and perform workouts that are going to make us sore. If we're saying soreness is probably means you're targeting the right muscles, but we don't want to chase that. That's not the goal. The goal is not to make the muscles sore per se. It's to progressively overload the target muscles. It's to consistently follow a program. If you end up being sore from that, fine. And if not, you're probably also fine, as long as the numbers are going in the right direction.
And would you suggest stretching after the training?
Stretching after the training is fine. It's a fine way to finish a session off, but it's definitely not necessary. In fact, if you're stretching for flexibility, resistance training seems to promote just as much flexibility as stretching does in research. So you're probably getting enough of that from your training. I would recommend stretching only if there's a specific reason for it, or if the individual simply enjoys it.
Okay, I would love to know more about your research. Are you doing anything at the moment? Any particular research?
My research at the moment is centered around helping other students. I'm doing more of a supervisory role. And
you work in Torrance at the moment?
Correct, yeah, working at Torrance.
Because I've had quite a few people coming from Torrance here as well.
Oh, really?
Yeah, I had Tim. I had one more psychology professor.
Yes,
came
Tim.
As well.
Tim's my boss at Torrance.
Tim Trevor.
Tim Trevor, yeah.
Yeah, he came for rehab.
Yes, yeah, he's
done
great.
With him rehab.
Yeah. And
we had another professor come for psychology.
Yes.
Mental health last week.
Yeah. I teach exercise science at Torrance. My research is more so now not affiliated to a specific university. It's just me helping students with their research.
Okay.
Looking at mostly proximity to failure, because that's what my PhD is about.
Yeah.
And hopefully that'll expand over time.
Very nice. Now, before we go to the one fun part, I want to ask the same question which I ask to everyone. When it comes to fitness and health, fat loss is number one. Okay. Everyone is always look for fat loss.
For sure.
Can you please suggest 3 principles for fat loss in top priority wise, and with not weight loss, fat loss?
Fat loss, yeah. Yeah, I think everybody knows about the calorie deficit. Everyone knows what a calorie deficit is, but many people don't understand how to be in a calorie deficit effectively. So the first thing I would say is ensure that your environment is conducive to your goals. So what I mean by this is, if you are trying to be in a calorie deficit, but the people around you aren't supporting you and they're tempting you with food, or you go home and you open the pantry and all you see are snacks, that environment, right, your environment at home, your work environment, your social environment is not conducive to you being in a calorie deficit. So for me, that would be the first thing to focus on when I'm working with a client. Get your environment right. The second would be ensuring that your meal structure and the foods that you choose to eat aren't highly palatable, right, and aren't calorie dense. So we need to find a way in our diet to reduce the palatability, to reduce the density of calories in the food that we have, so that the food that we consume within our calorie intake is satiating and is actually filling us up, because that's super important. And you can talk about a calorie deficit all day long, but if you're not considering those two important things, you're going to struggle. Your adherence is going to suffer. And the last thing being making sure we leverage our activity levels. So most people these days, I shouldn't even say most, but if you look at the population as a whole, maybe not most people watching this podcast, but the population as a whole could likely be moving more than they are, right? We probably have a sedentary population.
We do,
and moving more is only going to benefit your fat loss independent of your calorie intake. So, you know, you can eat a certain amount of calories, and the more you move, the larger the deficit you're going to have. If you don't move enough, you're going to need to eat less food to create the deficit you want. So finding a way to increase your activity levels without going out of your way and without inconveniencing yourself is really important. There's ways you can do that. You know, there's ways you can structure your day to do that. And over time, that can go a long way too. And of course, there's also longevity benefits to moving more and being quite active as well. So I would say environment, food structure, and movement are three important things amongst the calorie deficit.
Calorie deficit, obviously. And will you ever suggest your clients GLP-1 if they're struggling for years?
Yeah, I don't think I would suggest it myself, but I would definitely tell the client or urge the client to go and speak to a medical professional if they wanted to head down that direction. And if I thought there was justification for that, you know, definitely GLP-1s are going to be a game changer for, you know, the obesity epidemic. And in a population that is mostly overweight and obese in some countries, there's definitely room for those medications. I haven't specifically come across anyone who I have directly worked with yet that has needed them, you know, or that really wants to use them. Definitely the conversations pop up, but most people I work with, I would say, hey, you don't need to worry about that. You've got other things to worry about first, and you can achieve your goals without worrying about the GLP-1s.
Because it's very popular now, and I think easily available. And in fact, you can see the commercial coming on the Australian TV as well. They started telling people that if you're worried too much, just go and see your GP. So it's like that open. It wasn't that as open as it's now. And what's your say on peptides?
So I guess GLP-1s are a form of peptide. There's so many different peptides.
The reason I ask, because now obviously you are going to judge the bodybuilding. And I don't know how you're going to do it when it comes to natural bodybuilding.
Natural bodybuilding is going to be impacted by the peptide trend if federations don't do something on the front end to screen competitors before they compete. And it's very hard to do. Don't get me wrong, it's not like I think it's easy to just screen competitors, because let's say we sit down before you compete and I ask you if you've ever used any peptides. If there's no form of me fact checking that, you can tell me whatever you want and you can step on stage. And in fact, even if I urine test you after you compete, that's not actually going to catch the peptides, especially if you used them 6 months ago. So what we do at the WNBF is we do a polygraph test before the athlete competes. And the polygraph test, just like any test, has pros and cons. And yes, people can get around it, but it puts the athlete under pressure. It creates a barrier for entry, and it's a way for us to sit down and actually screen the athlete before they step on stage and say, hey, have you used any WADA banned substance over the last 10 years? And obviously an experienced polygrapher is then gauging to see whether they are telling the truth. That's better than doing nothing at all.
Yeah.
And yes, there can be false positives and false negatives, but every measurement that you do, every test that you do has an error margin, and you just have to find a way to try and reduce that error margin. We have an experienced polygrapher, we have procedures that are consistent across every individual, and that's what we're trying to do to reduce the chances of people stepping on stage. Enhanced.
Yeah, and are athletes happy to do it as well?
Yeah, athletes, we haven't had any issues with athletes, and I think that's because all the athletes we've had are actually natural. And there has been a couple that I've had to turn away, right? And then I have to say, hey, you can't compete, and they're okay with that. They say, okay, that's fine.
Exactly, they're not.
And whether they go off and compete at another federation is not really my business. But that's happened a couple times. I'm sure it'll happen more often. And yeah, we don't really have a problem, because I think if you compete with the WNBF and you have to do a polygraph test, you're likely going to be natural.
I think it's a very good idea. I mean, something is better than nothing to prevent it. So what do you think, where is this natural bodybuilding is heading in next 10 years?
Yeah, I think it's become a lot more popular, that's for sure. Natural bodybuilding is very popular. In Asia, it's booming. It's not uncommon to see 10, 20, 30 people on stage in Asia. So I think it's only going to grow, but I do have concerns around that. Whenever there's growth and there's more people doing a certain thing, there's also more room for people to cheat or for things to go wrong and for concerns to arise. So that's why I think the screening is so important, and just placing more of an emphasis on transparency around drug testing across all natural bodybuilding federations, I think will go a long way.
Wow, okay. That's very good answer. Now I'm going to have some rapid fire questions for you. Just have to answer as fast.
Okay. Pressure's on.
Pressure's on for you, definitely. And I'm not going to edit anything, I'm just kidding. All right. This is specifically for fat loss. You have to rate between 1 to 10. 10 is the highest recommendation. 1 is the lowest one. Calorie deficit?
10.
Strength training?
10.
Walking?
8.
Running?
4.
Portion control?
8.
Protein intake?
8.
Sleep?
8.
Meal timing?
6.
Intermittent fasting?
4.
Consistency?
10.
Tracking calories?
6.
Higher fat intake?
2.
All right, that's it. Now you're going to rate exercise between 1 to 10. Again, 10 is going to be higher. Squats?
Squats are good. 7.
Deadlift?
7.
Push-ups?
3.
Pull-ups?
I rate pull-ups probably a 7.
Stairmaster?
A good cardio option. 4.
Leg press?
10. Love a leg press.
Hip thrusting?
Hip thrusts are good. 8.
Grip strength exercising?
Overrated. 2.
Swimming?
Good cardio option. 6.
Pilates?
Depends on who you ask, maybe just a 5 in the middle.
Yeah, Pilates along with strength training, good combination.
Yeah.
Cycling?
Cycling's, I mean, for a cardio, great. 8.
All right. One exercise, last one. If you have to have one exercise for the whole life, which one you pick?
One exercise?
One exercise just for you, and you can only do one for the whole life.
Just for me or for...
That's just for you.
Just for me.
Like, what would you choose for the rest of the life if you have to choose only one exercise?
Yeah, I think it's... Logically, you'd have to choose something that works as many muscles as possible. So I'd probably go with something like a deadlift.
Yeah.
Because that's probably going to get me as much as possible in one exercise.
I think
but I would enjoy doing a bench press more. So.
but I think choosing deadlift is better because you'll be giving overall full body exercise right there and there. Now, is the one myth you think over the years has refused to die? Years ago, even now, and it's going to be there for next few years, of probably forever.
Yeah, there's lots of myths that tend to circulate and linger, and it can be frustrating. There's a myth around women needing to train around their menstrual cycle.
Yeah.
And I'm not sure that one's really ever going to go away. I think people will always find a way to incorporate that into their message and showcase to women how unique their training needs to be.
Yeah.
You might hear the statement that, women aren't small men. And I mean, that's true, but that doesn't mean that training has to be completely different. That statement's often used to try and emphasize to women that their training has to be completely different to a male's training. But definitely when it comes to the menstrual cycle, we don't have to synchronize training with different menstrual cycle phases. There's other ways to go about it, and that myth seems to get hit now and then, but resurfaces. And hopefully as more research comes out that I guess busts that myth, we see it just become eliminated really from
I agree.
social media information.
I keep seeing women when they come to me, it's like, I have my cycle on, I'm not going to come today. And it's like, why? But I feel weak. Like, you just feel weak here. Just come and try and probably lower the load for continued movement. So no, I agree, keep on coming. The other myth I think is keep on coming is women always think they're going to get bulky, especially when they start. Like, obviously once they get used to it, but I think every woman go through that stage when they start that I'll get bulky. And when they say that, I've asked many women just for my own research, what do you think?
Okay.
And they literally vision of bodybuilders.
Yeah.
Now I want you to explain that, why they think that, and having a bodybuilder physique, it's how hard that sport is, and to achieve that physique.
Yeah, it's quite fascinating to think that even when I entered the industry 10, 15 years ago,
Yeah.
that myth was prevalent,
Yep.
and it still is now.
It's still there, yeah.
And it's just not going to happen. And we have so many people trying to build muscle day in, day out, trying to get as big as they possibly can, and it takes them years. Some people never even achieve that, and so women shouldn't have that concern. I can maybe see why those thoughts arise, because they want a certain body and they don't want to do anything that is going to compromise that. But strength training absolutely will not make a woman bulky. The female body will respond the same way as the male body, and if you lift weights, you'll build some muscle. The muscle will become more toned, you'll get stronger, and the way you configure a program can influence that. The way you eat can influence that, and as long as everything's aligned, strength training can definitely be used to build the body that you want, that a woman wants, and getting bulky should absolutely not be a concern.
I know, I agree. And when you do research, when you do a PhD research, it's probably a silly question that comes from me. Do you guys do on male and female both, or just a male?
We try and do both, and I guess it depends on the research question, but in my research I try to recruit both.
That makes sense.
Sometimes it's a bit harder to recruit women, but I guess that just depends on where you're situated. In my context, it was fine, and I was able to recruit an equal amount of males and females across most of my studies. And I don't think it's as much of a problem as people make it to be. Like, the whole research doesn't use that many women, so we can't look at a study in men and then extrapolate that to a female. I don't think that's a very consistent argument, because like I said, the body responds similarly, and so we can use research in males to come up with something for females. But in saying that, it would be great to see more and more research in females as the years go by, for sure.
Yes, I think it's a good idea if we can include that as well, because then we can, as a coach, we can say it's been done on female throughout the month.
Correct.
And it's still working exactly the same.
Exactly.
And that's when we can say it's evidence-based for female as well.
Yep.
All right, before we finish, do you have anything else you want to include?
I think we covered quite a bit. I think that's good. Yeah.
You sure? Anything that we left out that you think that we should add?
I think we obviously started the conversation speaking about people entering the industry.
Yep.
And I would urge people to find podcasts like this to listen to.
Yeah.
And to remember the things that we spoke about that make someone more evidence-based. So the way they communicate a message, the way they convey their information on social media, all those things. I urge people to look out for these types of individuals that they can listen to and that they can put their trust in for information. And of course, we're always going to have social media there, pushing information to our faces every day. And we just have to be smart about the people we follow and the information we do decide to, take aboard. Because if you take on too much, it can become confusing.
All right. Thank you so much. So thank you so much, Martin. And absolute pleasure to have you on the show. Before we go, can you please tell our audience where can we find you and how can they reach you if they need help?
No worries. You can find me on Instagram. Just search my name up and I'll be there. You can also check out jpshealthandfitness.com.au and check out the JPS Health and Fitness and JPS Education pages to look into more about what we do. And if you want to hear more about my stuff, you can probably do a YouTube search and you'll find some podcasts there.
And please arrange more workshop for brand new trainers. I think they need it.
For sure.
It has helped me and I'm sure it will help many people as well.
Awesome. No worries.
And thank you so much for watching The Balanced Talk Show. If you like it, please share, subscribe on YouTube, Spotify, Apple. Share it with your friends and I'll see you in next episode. Till then, stay balanced, stay healthy. Bye.